Somebody's talking about CPAP usage, negative side effects. CPAP. CPAP, is great for those people who aren't able to get rid of their obstructive sleep apnea from weight loss. Sleep apnea being, or obstructive sleep apnea being where there's floppy tissues in the airway, in the back of the throat that close up when you're breathing. And so there'll be efforts to breathe to open that up and air won't move. So a person will actually be apneic or not breathing for a period of time until they reach a point that makes such an effort, it opens up the airway and then the air rushes through and you hear this loud, type snoring sound. Oftentimes it'll be, diagnosis is based on the story of whoever's sleeping with the patient, usually their spouse, who will say, yeah, he stops breathing and then will suddenly wake up making these really loud snorting sounds. That's typical for sleep apnea. And no air is getting through. And the person's oxygen levels in their blood is coming down, down, down this whole time, including blood supply to important organs like the brain and the heart and lungs are not getting oxygenated. And so changes happen that contribute to problems down the road, like higher pressures in the lungs and brain cell damage. So they'll give a CPAP, continuous positive airway pressure, which is a mask that's worn over the face and blows in air just to keep the airway open so it doesn't close up. Well, you can imagine what this feels like just by thinking what it's like when you're a kid and you stick your head out the window, before we were required to wear seatbelts. Stick your head out the window and try to breathe as you're going down the freeway. The air is being pushed in with a greater pressure as you're driving down the road and the wind's hitting you. And it's hard to relax enough to breathe comfortably. Well, that's what CPAP is like when people first start it. It's hard for them to breathe comfortably. Yes, thank you. And we'll catch you later, Princess Mission. So it takes a while to get used to it. They wear this mask. It gets leaks if they move around too much. So it's kind of uncomfortable. It can be really dry. Yes, you're welcome. And it can be loud because it actually has an air pump with it. So the downsides are the noise, difficulty getting a seal, possible nosebleeds because it dries out the airway, although they can put fluid and have it bubble through water to help keep it a little moisturized. But not serious bad sides. For the most part, it's good if you can put up with the treatment. It's just more of an annoyance than anything. So yes, I do recommend people use CPAP if they can't get relief of their obstructive sleep apnea through, say, weight loss or, pretty much weight loss is there's another treatment. I'm sorry, there's one other treatment. And that is for a dental device that's sometimes used for cases that aren't quite as serious, that holds your lower jaw out in relation to your upper jaw because they have your teeth in it. And so it pulls the jaw forward, allowing more room for the airway in the back. Anybody in medicine that's in emergency situations knows that you try to get that jaw forward when you're trying to open up someone's airway, excuse me, when they're unconscious or they're not breathing. So I need to run. We got patients. I can hear them rooming them in the other rooms. Thank you so much for being a part of this. Yes, you absolutely welcome BP63. If you don't already follow, swipe right and follow. If you're on YouTube, please find it. One of these places will be a little subscribe message. You just click on that and you can subscribe to the channel. And of course you can share all these videos with your friends if it's a topic that they are especially interested or health problem they have, family member or friend. Until next time, this is Dr. Vaughn telling all of you wonderful folks to stay in good health.